And now I'm talking to Carol Moore from Dual Diagnosis Ireland. Carol, how's it going?
Hi Darren, lovely to meet you and thanks for coming out to talk to us. Really
O-
appreciate it.
Okay, that's great, Carol. Could you tell us about who are first of all who are Dual Diagnosis Ireland and the work that you do, please?
Okay, well we're all volunteer registered charity, and how we got involved was I've been in the healthcare system since I was 15. I have an autoimmune disease, and there's been huge improvements in healthcare in the time that I've been involved, over 30 years now. So when a family relative got ill, it was agreed that I would help this family relative actually navigate the healthcare systems, which, as you know, Darren, are very complex. And that's when I learned about mental health and addiction, the whole dual diagnosis issue. And unfortunately, our family relative died. And my sister was training to be a counsellor at the time, and she was involved with another leading figure, Owen Stevens, who's a specialist in addiction. So we said we would set up the Dual Diagnosis Ireland charity as a way to raise an awareness of the need to treat addiction and mental health issues together.
Yeah. And I talked to you a couple of times before the interview we're doing now. There are, and I've heard this before many times. There are apparently huge gaps in the mental health services, aren't there?
Yes, there are huge gaps in the mental health services. We don't spend enough on mental health. We don't see it as an integral part of healthcare. We have a lot of training issues, a lot of cultural issues. Like at one stage, if you step back in time, we actually locked up more people per capita than the Soviets did. So that shows you the history and the legacy of our mental health care systems in Ireland. And then addiction systems, they're not properly funded, staff don't have the time to get training. It's a very low priority. So if you have both a mental health issue and an addiction issue, it's actually really difficult to get the right type of treatment.
Yeah, I was talking to Father Peter McVeigh there a couple of weeks ago, and he was saying that if you're in the public healthcare system, and if you have a dual diagnosis, the services are pretty much non-existent. Well, they're nearly non-existent. Is that true?
That is very true, and Father Peter McVeigh, brilliant guy, has been drawing attention for this for donkey's years, and he's been very vocal about it. And the sad thing is that if you have private healthcare insurance, there are actually dual diagnosis programs you can access. If, say, you live in Donegal the mental health services incorporate the addiction services. So it's like a postcode lottery. It depends on where you live. And what happens is people bounce around the services. So the mental health services say, well, we can't treat you until your drink problem is sorted. And then the addiction services say, well, if you stick to this program, you'll get sorted. But if you have an underlying mental health issue, it's actually very difficult to stick to a treatment program which operates on the basis that you don't have a mental health problem. So people literally bounce around the services and they end up dead.
And we spoke before the interview about alcohol and alcoholism. Can you just give us your view on that, please?
Alcohol is a huge problem in Ireland, and there's huge debates about which treatments are effective, which aren't. But we do know that the treatment systems in Ireland are not effective. There's been numerous reports out of it. And you can see that we've 11,000 hospital beds in Ireland in total. And at any one night, we have between 1,500 to 2,000 beds occupied by people with an alcohol-related illness. So we really have a huge problem with alcohol. And the way we approach the issue of alcohol, there's very little leadership on that issue at all.
Yeah, and I suppose, are you in favour of the public health alcohol bill? Like, if it comes in, think that'll be a good, it mightn't be ideal, but I think it's a step in the right direction.
It's definitely not ideal. It does not ban marketing of alcohol, which we know is a huge driver of alcohol abuse. But it is a step in the right direction, because what it does is it targets the problem drinkers. It's not going to affect the person drinking in a restaurant a bottle of wine. What it does is it targets, the cans of beers that are cheaper to buy than a bottle of mineral water. And we know young people, who we know in Ireland have a very heavy drink problem, are very price sensitive. So if we increase the price of drink that they buy, they will drink less. And we know for the problem drinker, it targets them as well. There's been huge intellectual evidence to support this. So it really will have an impact. And the sooner the better that bill comes in.
Yeah, I know a lot of people working on alcohol services and drug services think that like alcohol advertising should be banned completely. Like when this act comes in, there's supposed to be a review of that section of the act in 3 years. But I suppose it's a step in the right direction. But you were telling me you're involved in some study or something at the moment about alcohol, eh?
Well, we're not involved in an academic study as such. What we're doing is we're trying to develop an early intervention system for alcohol abuse so that there is huge stigma around having both an alcohol problem or a mental health problem. And when you have both, it's a huge issue. And what we want to do is actually help people get access to treatments earlier. So we know that 1.2 million people are abusing alcohol in Ireland today, but officially we provide treatments for just 8,000 of those people. So what we're doing is we're trying to develop an online treatment system called Alcohol Coach, where people can go online, they can assess their drinking, but they can also start getting support to help them deal with their drinking. So we hope to make it easier for people to actually deal with their alcohol abuse.
I know you're not like a therapist or a psychiatrist, but like a few years ago, like I used to have a drink problem. I'm off for nearly 5 years, but one thing I learned about the gaps in the mental health or in the health services, like if you got AA meetings, I haven't gone over about 3 years or more than 3 years, but I went over probably 200 AA meetings over the years, and in AA, they'll tell you, like, they'll say alcoholism is a disease. And once you have the disease, even if you're a year sober, you have to deal with life one day at a time. And it's very humbling, you know what I mean? But my experience of dealing with psychiatrists and I had a drugs worker as well, briefly, they kind of don't understand that alcohol, but the whole that's a whole debate, isn't it? I've researched this, and it's not conclusively proven that there are different opinions, aren't there, whether alcoholism is a disease. Because I personally think that there are some people, a lot of people, who develop alcohol problems, and it's in their kind of genes. You know what I mean? Would you think that?
I think there's been huge debate around whether it's a disease or not, and there's been a lot of stigma and shame around the whole issue of alcohol abuse. And what I think we have to recognise is there are different levels of alcohol abuse, and people actually abuse alcohol for very different reasons. So, for example, if you have social anxiety or if you have depression, you may drink to actually resolve your social anxiety, so you can have a social life, or so you can get over your depression. And if for those people they are helped to deal with their depression and social anxiety, then the alcohol abuse isn't a problem. But we do know there is a genetic component that different people react differently to alcohol. And many people who would label themselves as alcoholics will say that from day one, once they started drinking, they always got drunk. It was never enough to have one or two drinks. They always had to finish off the bottle. They drank faster. And I think what we haven't done enough work in is to try and profile the different types of alcohol abuse. So we do know we have the people who have a physical dependence on alcohol and who need a medical detox. We have people drinking in harmful or hazardous ways. But what we don't have is a diagnostic test. So we can actually work with people and say, well, actually your genetic profile or what's appearing here indicates that you should never drink at all, because you're always going to react badly to it, and you'll quickly develop a physical dependence on alcohol, and then be able to say to other people, well, maybe it's a lifestyle issue, and maybe it's about dealing with what's going on in your life and the reasons why you're drinking, and then maybe you might be able to drink moderately. But unfortunately, I haven't come across, and as you said, I'm not a clinician. I do have a master's in psychology. I have worked in this sector for a long time, but we don't have those type of clinical tests. And I think we tend to get over-involved in trying to define it, rather than actually listening to the person who has the problem and saying, what do they need? How can we best help them? This person-centred approach, I think, is badly needed, not a sheep dip approach.
Yeah, I think that would be like a brilliant if that happened, because like if psychiatrists and the person themselves knew what kind of category they were in, like if it's in your genes, for example, like I was going to say, like my experience of dealing with, I haven't dealt with a huge amount of them, but psychiatrists in the public health system and therapists and one drugs worker, they kind of, it was as if kind of alcoholism like was the kind of private, alcohol problem was kind of private matter, and they kind of left it up to you to go to AA and deal with that. You know what I mean? I just found that very it's a very lonely road. You know what I mean? So it'd be great if there was more, if there was more tests done, wouldn't there?
Yeah, I mean you're quite right. I mean, and that would be the experience of a lot of people, because we don't have developed alcohol treatment services, and a lot of doctors themselves would feel they haven't been trained properly to actually deal with alcohol issues. And quite correctly, a lot of doctors feel, if I do an assessment, of somebody for alcohol abuse, where do I refer them? How do I help them? Because the backup services, they're just not there. And we don't put enough money into it, and we don't train the psychiatrists. And there is a real debate about it. A lot of psychiatrists would feel addiction isn't part of their brief, that they shouldn't be treating addiction. Obviously, we would come from the view that, look, you help the person in front of you, and if you can't provide the services, it is still your responsibility to refer and make sure that that person gets help somewhere else. And just referring somebody to AA, that's not good enough. AA has helped thousands of people, but if there's an underlying mental health issue, as a healthcare professional, you have a responsibility to make sure that person gets the type of help they need. And it shouldn't depend on where you live as to whether you get the right type of help.
Yeah, and I only heard recently actually that I think it's the biggest alcohol treatment centre in the country, Clonwera, is that what it's called?
Yeah.
Like it's run by some order of the Catholic Church, I think. Yeah. But you actually have to go to mass if you go there, don't you?
That's right. Yes. Now Clonwera has helped thousands of people, and it's funded by the HSE. We have heard stories that people who go there have been told to get mass every day, and if they don't get mass every day, then they're not welcome to stay there. And I think part of this problem is that if you go to what's called an approved mental health service, which is a centre recognised under the Mental Health Act, that centre is inspected by the Mental Health Commission. Right. There is no independent inspection of residential treatment centres. In fact, the Controller and Auditor General did a report of community addiction services and said, we don't measure how effective these services are and what they're doing. We don't have an evidence base behind them. So we really don't know whether the services we're providing to people are actually helping people. We've no systematic way of saying, well, if you go into this centre, you have a 60% chance of being sober in a year's time. We don't have anything like that. And a few people have written books, for example, Valerie Farher mentioned in Come Back When You're Sober, that the same programme is offered to you each time you go in. It doesn't actually look at what you need and help you to deal with the issues in your life. For example, when I go in, I have an autoimmune disease. If I go back to my consultant and I say, I'm feeling bad, it's just not working, he doesn't say to me, well, Carol, you're not sticking with the programme. We go through what the issues are, and maybe it's I haven't been taking the medication correctly, but maybe it's the medication needs to be changed, or I need to do more physio, or I need to do more exercise. But we have that discussion. I'm not told, well, you have to go through this programme, and once you go through this programme, you'll be fine. It's a partnership, it's a discussion, and I think we need more of that in our addiction treatment services. Well, I think it's key maybe for people listening to realise that where they have an addiction, or where maybe a loved one has an addiction, that they recognise that when they go for treatment for that addiction, it's not going to address their underlying mental health issues, right? That they may need separate help for that, and they won't necessarily be referred for that mental health services. So one of the things we've done, and it's available on our website, just Google the A to Z of Irish Mental Health Services, and that will give you a complete guide to finding your way around our very, very complex mental health services and finding the type of help that will help you, because everybody is different.
Yeah, and I read there recently that the Minister for Mental Health, Kathleen Lynch, said that she's really determined that in the upcoming budget that the money for mental health services mental health services in the community will be allocated. But like even if it is, like the addiction services are still very far behind, aren't they?
Oh, very much so. I mean, I think it's down a lot to mental health reform, and I'm associated with mental health reform, so I'll just mention that. But they have done an awful lot of really good campaigning work with the Minister and with the HSE to try and get additional resources for the mental health services. But mental health services do not have responsibility for addiction services, and we don't have anybody in the addiction services who are totally focused on campaigning, like Solace. Jerry McAlison, I think it is, has done great work, and they've been in with the Doyle Committee, but they're providing a service. They are put to the pin of their collar because of cutbacks in funding. They don't have the time to campaign. So we've nobody in the addiction service doing the same thing. So one of the things we in Dual Diagnosis Ireland encourages for addiction services and people concerned about addiction services to support mental health reform, because a dual diagnosis issue is firmly on their agenda. So it also then brings mental health and addiction services working together, which is what we badly need.
And you're saying up in the Letterkenny General Hospital, I think it is that the mental health services and addiction services are treated together, are they? Are they under mental health or what?
Yes, I was talking to one of the people up there, and they were saying that it's one of the few mental health services where addiction is formally part of the mental health service, so that when clients or patients present with an issue, they can be dealt with in an integrated fashion. And the Mental Health Commission did do a quick review of this area, and I found it very much depends where you live as to whether you get this integrated service or whether you're referred from Billy to Jack. And it's unfortunate for people. And one of the things I would say to people, that if you're admitted into an acute mental health unit, which is known as an approved unit for, say, a detoxification, and they're saying, well, you need to get help from an addiction service, we can't help you, we're going to discharge you, that you do have rights. And in the A to Z, we go through what those rights are, which is that they can't just discharge you. You have a right to a care plan, right? And that care plan is really important. It states what are the goals for you, and if you are being discharged, that there is a care plan in place. So it's very important that people know their rights, because very often services are so stretched, they're so overworked, that the care plan isn't put in place properly. So do not accept a discharge from a mental health hospital until you have a care plan that you are happy with. And I would say that to families as well.
And so would you be in favour of people with drug addictions and mental health problems being treated for both problems in the mental health services in the community and in inpatient as well?
I think what we need to look at is, what do people need? We need a range of services. It's not one size fits all, right? So if somebody is living in the community and they're participating in their activities and they're what the healthcare professionals call highly functioning, they don't need to go into an inpatient. They might need a detoxification. That should be done in the community. They shouldn't have to go into hospital to get a detox. But very few community-based detox services are available. So that's, an issue, even though in other countries these are routine, that you don't have to go into hospital to have a detoxification, unless you have quite complex physical health and mental health needs. So I think what we need to have is very clear clinical pathways, so that we treat people at the earliest opportunity, that they get the right type of service at the first time of asking. So if they go to see a GP, that the GP has time to talk to them, that the GP can refer them, say, to counselling if that's what's needed, can refer them into psychiatry if that's what's needed. If it's about them, they're drinking too much because they need a job, because they're unemployed, how do we help them get back into the workforce? So mental health isn't just about one type of service. It's about a range of services, and we really need to meet people where they're at, rather than saying, well, this is what we provide and this is what you take. Right? We need to be much broader in terms of our approach, because that's what works.
Yeah, I don't know a lot about other addictions. Maybe you can talk about them maybe as well if you want, apart from alcohol. But I think for a lot of people who had a drink problem or who were alcoholics, I think that this may not apply to a lot of them, but a lot of them are us like. Once you have the drink problem, even if you're months or years sober, you still have to deal with life one day at a time. So I think there should be some. I think people drink recovering alcoholics should be able to go for a quarterly appointment or something in mental health service just to talk about how they're getting on their addiction problem. Like I remember the first AA meeting I went to years ago. I was talking to a fella before the meeting, and I wasn't sure if I had a drink problem. And then I said to him, "I'd love to be able to drink just once a week, and be able to control my drinking. And he said, 100% of alcoholics would love to be able to drink once a week. The problem is we can't control our drinking. That's why. And so, like, I personally rarely think about drink, but that's because I don't go into pubs really. Like I heard one person say in an AA meeting, if you have a problem with overeating, you don't go into a sweet shop. I mean, I don't go into pubs, but it's something that, like, I think there should be kind of like people who maybe don't have a mental health problem, they had an addiction problem. I think there should be they should be connected with the system. Do you agree with that, Rick?
I would agree. I think part of the problem is we tend to make it very difficult for people to access mental health services. Like, you can be on a waiting list for months. Now, the current government has introduced counselling in primary care, and some areas have that, but already we're seeing long waiting lists actually build up. And I think this is where technology has a great role to play in terms of making it easier for people to access support. The trouble is that in Ireland anyhow, most of the online services are geared towards depression, anxiety, and they're very good, right? But there isn't a space for people who might have an alcohol problem to actually come together online and discuss those issues. Now, for women, and I believe men join it as well, there's Soberistas in England, which is a really good discussion board, and people can talk about their issues privately. So that's one way for people to access help, because again, it is so costly to provide services, and because of the lack of priority assigned to addiction services, it's unlikely the government are going to do anything much more about it. So I think people need to be proactive about seeking out help, and this idea of being able to just touch base occasionally, I think that's a great idea.
Yeah. And just to leave talking about alcohol, unless you have more to say about it, I'd recommend, there's a book my auntie bought me several years ago by Declan Lynch, the columnist with the Sunday Times. I think it's called The Rooms. I didn't read most of it now because some of the language is a bit like it's a bit whatever, but like it does. He had a drink problem as well, and the way he writes in the book, it's a fiction. I think it's a fiction book. Yeah, the way he writes in the book will really give you an understanding of, I think, like how alcohol is to a lot of alcoholics and recovered alcoholics. You know what I mean? Have you ever heard of that book?
I've heard of it, but unfortunately I haven't read it yet. It sounds quite interesting, so I would like to read it. But I do think we need to be very clear that for a lot of people, if we address their mental health issues, the problems with alcohol become a lot less. It's not going to solve the problems for everybody, but I think it is clear that people should never give up hope that they can recover from their alcohol, because they can, with the right supports and the right treatments.
Yeah. And would you be in favour of like more complementary therapies, like in the community? Like I can do Reiki. I'm not a Reiki practitioner now, but I'm attuned to Reiki. I've been attuned since I was 19, and Reiki was probably a huge, if not the biggest part of why I had the confidence and the ability to stop drinking and doing a couple of other drugs when I was younger as well. Would you be in favour of that, Rick?
I think I've used Reiki, and I think it's very good, and it's very helpful. And I think for a lot of people who don't want to talk about their alcohol, that techniques like Reiki, which are actually available in the NHS, are very useful and very important. But I think a huge problem is the lack of regulation in the sector. So people can make claims and for anything. You know, like David Beckham could come here and say, play football, and that will help you with your addiction. Now, exercise does help, so maybe it will help, but there is no regulation in the sector. There's no even voluntary register. You know, for example, we've 27, I think, different counselling associations, each with their own type of approach. But I do think we need to prioritise it, because if you look at, say, cancer treatments, where a huge amount of money and a huge cultural change has happened, we've created within cancer treatments that people can access these so-called alternative treatments. And I think body, mind and soul are connected. And we have to give people the greatest range of opportunities to get better that we can. And if they're unable to, say, deal with, say, cognitive behavioural therapy, which involves talking, then massage can be really useful. So I do think people should be able to choose between the techniques that are appropriate to them, rather than them being told, this is what is available, this is what you have. And I think those type of alternative treatments, once they're delivered by good, well-qualified practitioners, and we don't have any standards around that apart from within the individual associations, then that's important, because I think there are quacks out there who make all kinds of mad claims and mislead people about what the treatments can do. So certainly as an adjunct to treatments, I think they're very important, but I don't think Reiki on its own can actually solve a severe addiction problem, but certainly it is something that should be available to people. You know, I'm not an expert on drug addiction services, and, you know, my main kind of focus has been on alcohol. But I think it's sad to see the way drug addiction services have been treated in this country, and the way we label people with drug addictions. You know, we call them addicts. You know, we don't call people with cancer candidates, or, we create these very stigmatizing labels, and we don't fund the services properly. And we make it very difficult for people to access services. So I know, for example, a lot of the drug task forces, who do fantastic work, they now have long waiting lists. And staff burnout is a huge issue, because the staff in there very involved, working very hard, dealing with people committing suicide. There was a very interesting article, I think it was Declan Byrne in the paper there recently, about an individual they were trying to help. And despite their best efforts, he killed himself. So I think it's very sad to see that happening. And it's not just a moral issue of social justice. This is also costing the country an awful lot of money, because, you know, people who are high on drugs, they need to rob, to steal, to finance their habit. So we have criminals, and then we lock them up in prisons, so it costs us a lot of money. We did a very rough estimate some years back, and we discovered it was about 200 million a year it was costing to lock people up who had a dual diagnosis of mental health and or drug addiction, alcohol addiction. So even if we forget about the morality and the social justice, we should do it from an austerity basis, because we will save money. And I think as a country, you know, we stigmatise these people, and very often, and I think Father Peter McVerry has brought a lot of attention to this, these people have had tough lives. You know, they've had to deal with a lot of adverse events. And as Father Peter McVerry has often said, if I had their lives, I would be addicted too. So it's quite shameful, I think, as an Irish citizen, that we are treating people this way. And in many cases, the best we can offer them is methadone. And they have to be on methadone for the rest of their lives, and they have to queue up, and it's very stigmatising. And instead of giving them the hope of recovery and helping them deal with the issues with their lives, reconnecting with their families, we cut those services. We don't measure the effectiveness of those services. And we kind of think, no, you know, we don't want to know these people. And yet these people, they're human beings. And I often think, and again, Solis have done a great report on this, that there but for the grace of God go I. For many of these people, they don't have what the sort of people call recovery capital. They don't have the support networks. And they're, you know, they're a lot of the time they're not given the right treatments. You know, they're put on methadone, and that's it. And methadone, we have people dying on methadone. And it seems we have this kind of labelling that, you know, it's okay to go on methadone because we categorise that as a legal drug, but it's not okay to be on heroin because that's an illegal drug. And yeah, the drug that does the most damage is alcohol, which is a legal drug, right? So we're caught up in a lot of kind of misinformation around it. And I think we really need to do for addiction services what we've done in cancer. There used to be huge stigma about having cancer, and we brought in an international expert, and he drove a program. So now we have centres of excellence, and the recovery rates in cancer have shot up. In some areas, we're now at international standard, and that's what we need in addiction services. You know, and even in austerity, it makes economic sense to do it, because people who are on drugs consume more physical healthcare services. They're on social welfare. They're not able to work. Their families suffer. Their children suffer. You're much more likely to have a drug addiction if your parents were drug addicted. You're much more likely to have an alcohol addiction if your parent drank heavily. So it just, from every angle, it makes much more sense to invest in these services, to start holding them accountable. You can't hold them accountable at the moment because they are working to the pin of their collar. They're underfunded, you know, and people get burnout. So we really need to support the healthcare professionals working in these services and help them to deliver better services with proper funding. I mean, I know of centres where they don't have broadband, they don't have email. How can you run a modern service in that type of situation? So I think it really is important we start asking those questions.
Okay, Carol, thanks very much.
Thank you, and thanks for the opportunity to talk to your listeners.